does it have a treatment or does it have a cure? No, usually, yes, child crying when you deliver a child, okay, while the baby is in the womb, the baby does not cry, the baby cannot talk, the mouth is closed, okay. Now, by the time the baby comes out, it is expected that the baby should start breathing from the nose, and once that happen, at least we expect the child to cry. Now, if the child fails to cry at that time, cry abroad the number one thing you use to check. First thing you check is if the child is ventilating, the child on kukume, and again, what is actually the color of this child. That the child did not cry does not mean that that child is not healthy. In fact, that is why the midwife, the moment the baby comes out, the next thing they go, hey, we need to, and you will beat that child to the point that the child doesn't want to cry. And sometimes what we eventually end up killing the child, but the thing they were busy eating the child. You don't have to go to that extent. For me, the first thing is not that the child is crying or not. When the child comes out, in fact, why the baby is still in the womb, the first thing you start checking is that, is there fetal distress? Is this child distressed? Is the child breathing normal? Is the heart rate okay? You check all those things. When the baby now comes out, the first thing we look at is the activity of the child and all whatnot. What is the color of this child? Is the child breathing normal? In fact, sometimes if the child is not breathing, all you need to do is to raise the child up, tap the legs more, and rub the back. You don't need that excessive beating and trying to make sure the child cries. If the child is not ventilating, then that is the child you might give a small chest compression if there is no heart. There are two things we are looking at. We are looking at, is there cardiac activity? That means, is the heart beating, and is there respiratory effort? If the child is breathing well and the cardiac activity is okay, sometimes all you need to do is gentle warming and all whatnot. The child will cry. It's not a time beating the child. Sometimes there are some things that people don't know. Sometimes it might be that the child is so weak to cry. The child might be so weak, having passed through that birth canal, especially the first one. The child might be so weak. All we need that time is to give the child glucose. I don't know if you understand. And the child will cry. Now, even in an adult, in the next 1 hour later, some people will not want to say anything. They're already tired. Like this woman sitting down here. Why do you think she doesn't want to talk? She has no energy, no glucose. She has not eaten. And when you don't eat for a long time, what will happen? You become what? Tired. You don't want to talk. You don't want to. In fact, somebody will tell you that 2 + 2 is 8. You will say no problem, because you don't have strength for argument. So in that case, the child might come out, and the problem with that child as at that time was that the child is exhausted. If you check the blood sugar level, it might be lower than normal, and the child is just trying to conserve the small little energy nke o nwere enwe, and you are there hitting the child to cry. The child actually wants to cry, but there is no energy to cry. So when it comes, the prevention starts from day one. If a woman comes around, maybe she's 30 weeks or she's 32 weeks or 35 weeks, and the woman starts contracting, you yourself, you have felt that this woman might deliver before time. The treatment of that crying starts from that time. You start giving the woman dexamethasone. Give her an injection that will make sure that the lungs manufactures on time, preparing the child to start existing independently. So the treatment starts even before the child is born. So before the child comes out, we can give dexamethasone. We can give, sometimes when the woman has been in labor for a long time, you can check her blood sugar level. If you feel her blood sugar level is dropping faster than normal, because we cannot ask her to eat that time. Imagine a woman being in labor for like 6 hours, 8 hours, and the moment she has entered the active phase of labor, sometimes you discourage her from eating actively. So sometimes when it's coming to that point, we give 10% dextrose. We make sure that the woman herself has enough glucose, because it's the glucose that is in her blood. It is from there that the baby will get his own. Is it clear? So, but once the baby comes out, the first thing we look at is the activity of this baby. Sometimes you see the baby is struggling. The baby can even be holding your hand strong, and the baby is not crying. The color is good. Somebody will be beating the baby, you must cry. As if cry is a prerequisite for a. When you look at this baby, the activity is good. The child is breathing normal, and the heart rate is okay. All you need that time is gentle warming and all whatnot. Forget about whether the baby cry for Jesus or not. But there are some baby that will cry, 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 cry. That cry is telling you that all is not well. And you will be happy that the baby is crying. The baby will cry and die. So it's not that the baby cry or not. What I'm saying in essence is not that we don't treat cry. Cry is signifying that the baby might be okay or not okay. So all we need to do is to look around, look under and see what might be causing this thing. And by the time you address that, the problem is over.